Hola amigos, feliz viernes. Hoy es viernes. Yo soy Rory y estoy contento estar aquí contigo. So, just about a week ago, we wrapped up our early registration for our signature Mastering Medical Spanish course. It's 3 levels of medical Spanish. You choose beginning, intermediate, or advanced. It's a 10-week course beginning in February. So we offer this twice a year, February, and then in the fall as well, September, late September, October. So if you want to get in, there's still space. If you're not registered, there's still space for you. We're in this 2.5-week review time and ramp up time with a foundations lesson. For each level, there's a lesson that gets you prepared for your course. So if you missed the early registration window, no problem. You can still get signed up. Look below this video for links for the Mastering Medical Spanish course. We'd love to include you in it. All right, so earlier this week, let's get on with our lesson. Earlier this week, I did a lesson with some residents here, one of our local family medicine residency programs, and we talked about back pain. I thought I would share with you what we did. Okay, so primero, before we get started, with this back pain lesson, there are a couple of other lessons that make sense for you to review. One, talking about pain, el dolor, and I'll make sure these links are down below the video as well, so look below the video to find the links off to these other lessons. So a lesson about talking about pain in Spanish, and then a lesson talking about the history of the problem in Spanish. We're going to be using some of this vocabulario in our lesson today, and with some of the conversational practice scenarios for you too. All right, let's get started with some anatomía relevante, vocabulario, building vocab here. So we've got el coccyx, right? El cuello or la nuca, so el cuello, neck, la nuca. Nuca is like the back of your neck, like the nape of your neck, okay? Bien, this is all anatomía relevante to back pain stuff. El disco, disc. El muslo, thigh. El sacro, sacrum. La cintura, waistline and lower back. So la cintura could be anything related to your cinturón, which is your belt. So it could be your full waistline. It's also referred to commonly as your lower back, la cintura. La columna vertebral, spinal column. And we could have la columna cervical, so the cervical spinal column, right? Torácica and lumbar, okay? So to talk about the 3 general regions of your spine. El espinazo and la espina dorsal are other words for spine and spinal column. But I think if you just go with la columna, it's super common. Just la columna, not even saying vertebral. But if you were to say vertebral, great. So, but la columna in general, think of, if you hear that, it's spine. La espalda, back in general. La ingle is groin. La médula espinal, so the spinal cord. La pelvis, pelvis. Vejiga, bladder. La vértebra, vertebrae. Las costillas, ribs. Las piernas, legs. Los costados, sides, like el costado derecho, el costado izquierdo, sides. Los glúteos, a great word for bottom or butt for adults, los glúteos. Los hombros, shoulders. Los ligamentos, ligaments. Los músculos, muscles. Los nervios, nerves. And los riñones, kidneys, okay? All right, so that's some anatomía relevante. Use the flashcards below on the blog post here to study up. And if you're viewing this video on YouTube, head over to the blog post so you can work some of this vocabulario and commit it to memory. All right, signos y síntomas, some signs and symptoms of back pain. So debilidad, weakness in general. Dificultad para is our way to say difficulty doing something. And we usually add a verb right after it. So dificultad para agacharse, bending over. So difficulty bending over. Dificultad para caminar, difficulty walking. Dificultad para levantar objetos, so lifting objects. Dificultad para hacer popó. It's a fine way to say go poop or move your bowels kind of thing. Dolor. Dolor ardiente, like a burning pain. Dolor de los nervios, like a nerve pain. Dolor intenso, an intense pain. Dolor muscular, like a muscle pain. Dolor punzante, stabbing pain. Dolor que corre or que se mueve, so a pain that corre, like shoots. Correr is our verb for run, so dolor que corre, with the best interpretation is a shooting pain. Dolor que se mueve, just pain that moves, okay? Dolor moderado, a moderate pain. All right, entumecimiento, numbness. I'm sorry, it's a really long word. Numbness is actually kind of long too when you write it out. But anyway, entumecimiento is how we say numbness in Spanish. Espasmos musculares, so muscle spasms. Fiebre, fever. Hormigueo, tingling. Movimiento limitado, so like limited movement. Náuseas, nausea. Orina turbia. Turbia is our adjective for cloudy, so orina turbia. Okay, so we've got anatomía relevante, some signos y síntomas comunes. You probably have some other signos and síntomas comunes. Feel free to find the comment section below, make a comment, and we'll help you with how to describe those signs and symptoms as well. Let's start looking at some causas comunes, and we'll just give some very simple descriptions of some of these causes of back pain, okay, in Spanish. So, disco herniado or disco roto, so a herniated or torn disc. El disco es el cartílago entre las vértebras. Okay? So the disc is the cartilage between the vertebra. Si se comprime, sale de su lugar o rompe. So if it gets compressed compressed, it slips out of place or it tears. Causa mucho dolor e inhibe movimiento. So it causes a lot of pain and inhibits movement. Esguinces y distensiones. These are basically strains and sprains, okay? Un estiramiento excesivo, so an excessive stretching o desgarro, tear del ligamento, tendón o músculo, puede ocurrir con levantar objetos pesados. Can happen when you lift heavy objects o torcerse, or if you twist de manera incorrecta, if you twist in the wrong way. Pueden causar espasmos, they can cause spasms en los músculos, in your muscles de la espalda y provocar dolor and cause pain. Estenosis espinal. El canal de una o más vértebras se estrecha y pone presión sobre la médula espinal y los nervios. So the canal of one or more vertebra se estrecha, gets narrow, y pone presión, and puts pressure over the spinal cord, on the spinal cord, y los nervios, and the nerves. Causa dolor, causes pain. Entumecimiento, what was that one again? Numbness. Y debilidad, that one? Weakness. Okay, all right, let's continue with otras causas comunes. La ciática y los nervios comprimidos, so sciatica and like pinched nerves. Los nervios de la médula espinal a veces se comprimen o se pellizcan. Sometimes they get compressed or pinched. Puede pasar después de un accidente. This can happen after an accident, con ciertos movimientos, with certain movements, o por presión de un disco, or because of pressure on a disc. Causa dolor que corre. What was that one? Dolor que corre? It's a shooting pain. Hormigueo, tingling. Entumecimiento, numbness. Y debilidad, weakness. Escoliosis y otros problemas esqueléticos. Curvaturas y formas anormales de la columna pueden causar dolor con tiempo. So curvatures and abnormal formations de la columna of your spine pueden causar dolor, can cause pain. Una infección de la vejiga y los riñones. So bladder and kidney infection. Cuando una infección de la vejiga o del aparato urinario, so when a bladder infection or a UTI, aparato urinario, se extends hasta los riñones, gets up to the kidneys, empieza a causar dolor de espalda, begins to cause back pain. Este tipo de infección normalmente incluye fiebre, so this type of infection usually includes fever, náuseas, vómitos y dolor de la ingle también. And what was dolor de la ingle? What's ingle again? You could guess it. Groin, dolor de la ingle. All right, más causas comunes. Artritis. Una inflamación de las articulaciones en la espalda. So an inflammation of the joints, articulaciones, joints. En la espalda, los espacios entre las vértebras. So the spaces between the vertebrae. Esta inflamación provoca dolor, so this inflammation causes pain, y rigidez que se mejora con movimiento, and rigidity or stiffness that improves with pain, with movement, que se mejora con movimiento, that gets better with movement. Piedras renales, So kidney stones, piedras renales, son cálculos, they're calculi que forman en el riñón, that form in the kidney, y no pueden pasar, and they can't pass por las vías urinarias, and they can't pass through the urinary tract. Causa dolor lumbar, causes back pain, lumbar back pain. Dolor al orinar, pain with urination. Orina oscura, dark urine. The other adjective we used earlier in the lesson was orina turbia, turbia. Y otros signos de infección, and other signs of infection. El embarazo. Por el peso extra, because of the extra weight que lleva mamá en el útero, that mom carries around in the uterus, los músculos de la espalda, the back muscles, se esfuerzan, strain, más para mantener la postura. More, they strain more to maintain posture. Puede producir dolor. This can produce pain. Músculos adoloridos, sore muscles. So adolorido is a great word for sore. Músculos adoloridos y rigidez, and rigidity. Let's take a look at some exámenes and imágenes used to diagnose back pain. Okay, so para diagnosticar, we've got análisis de sangre, so a blood test, análisis de orina, a urine test, estudios de los nervios, so any kind of nerve study or nerve test, escaneo de la densidad de los huesos, so bone density scan, examen físico, physical exam, tomografía computada, so a TAC, a CT scan, tomografía computada, resonancia magnética, una resonancia magnética, MRI, y radiografía, or rayos X. Okay? All right, so we've got a handful of exámenes e imágenes. How about some sugerencias para ayudar y prevenir? Unas sugerencias para ayudar y prevenir. So some suggestions to help and prevent back pain. Haga ejercicios de fortalecimiento y estiramiento. Do exercises, do strengthening and stretching exercises. Ejercicios que fortalecen, strengthen. Ejercicios que fortalecen y estiran, stretch, los músculos de la espalda y el abdomen le dan mejor equilibrio. So exercises that strengthen and stretch your back muscles and abdomen give you better balance. Más fuerza, more strength, y mejor equilibrio and better balance, bajan el riesgo, lower the risk, bajan el riesgo de lesionar la espalda. So they lower the risk of hurting your back. Preste atención a la postura. So pay attention to your posture. Es importante pararse y sentarse con la espalda recta. It's important to stand, pararse, y sentarse, sit, con la espalda recta. So with your back straight. También, si usa una computadora en el trabajo, hay que asegurar que el monitor, also if you use a computer at work, hay que asegurar que el monitor y el teclado están en buena posición. You need to make sure that the monitor and the keyboard, el monitor y el teclado, keyboard, están en buena posición. They're in a good position. Más sugerencias, más sugerencias. Levante objetos pesados con las piernas. So lift heavy objects with your legs. Hay que doblar las rodillas. You have to bend your knees y mantener la espalda recta and keep your back straight cuando levanta objetos, when you're lifting objects. También es importante pedir ayuda. It's also important to get help cuando necesita mover objetos pesados. We need to move heavy objects. Cambie los movimientos repetitivos. So change your repetitive movements. Es bueno alternar entre actividad exigente. It's good to alternate between exigente is demanding activity, y actividad menos exigente, less demanding. Y si puede usar equipo, and if you can use equipment para levantar y mover objetos, mejor. And if you can use equipment to lift and move objects, that's even better. Okay, so we've got a lot of vocabulario here, some phrasing, some descriptions, etc. Here's what I want you to do now. I'm going to give you 3 different cases to practice, okay? 3 casos para practicar. And what you'll do is you'll rely on some of those other lessons about pain and questions about pain and the history of the problem. You rely on some of that vocabulary and some of those questions and phrasing to work with your conversation partner about these casos. So here's caso número 1. David tiene 16 años y ha tenido dolor de espalda baja por 2 meses. So he's 16 years old. He's had lower back pain for a couple of months. Pesa 260 libras, so he weighs 260 pounds. Juega fútbol americano, plays football, y el dolor está peor cuando juega, and the pain is worse when he plays. El dolor no se mueve, doesn't move, no es irradiado, it's not radiating pain. Los rayos X del mes pasado, so the x-rays from last month, no demuestran una fractura. They don't show any kind of fracture, okay? So, David, paciente número uno. So when you do this with your partner, one of you is David, the other one is the professional asking the questions, talking about la historia, el dolor, and giving some descriptions about what's going on with his back. Caso número dos. Julia tiene 32 años y tiene dolor a media espalda por 2 días. So Julia's 32 and she's got pain in her middle back por 2 días, for about 2 days now. El dolor es persistente, it's persistent. Parece que no está relacionado con su posición and seems to not be related to her position. También tiene escalofríos, so she also has chills, náuseas y vómitos, chills, nausea, and vomiting. Okay. So again, you and your partner, one of you is patient, one of you is Julia, and the other is profesional. Work through descripciones del dolor, los síntomas, history of the problem, etc. Y después conversar sobre la causa probable de su dolor de espalda. Caso número 3. Jimena tiene 20 años y es muy activa. So Jimena's 20, she's super active. Ella juega fútbol en la universidad. She plays football at university. Recientemente ha notado que tiene espasmos musculares. So she's recently noticed she's got back spasms en la espalda. En el lado izquierdo, on the left side of her columna vertebral, it's the left side of her spine. El dolor no es constante. It's not constant, pero cuando lo tiene, but when she has it, es agudo y fuerte. So it's sharp and very strong, severe. A veces aún tiene dificultad para respirar. Sometimes she even has difficulty breathing cuando el dolor viene. All right. So, preguntas, post them in the comments section below. If you need a conversation partner because you don't have one, head over to the Learning Medical Spanish Facebook group. There's several thousand people in the group. Put yourself out there and say, hey, I'm at this level. I'm looking for a conversation partner to practice some Spanish with. Who's available? And you can begin to DM each other. All right. Muchas gracias por aprender español conmigo. Juntos mejoramos comunidades. Para más español, make sure you head over to the website, commongroundinternational.com. Y if you'd like to take a free medical Spanish terminology test, head over to certifiedspanish.com. Register for free, and you can take as many medical Spanish terminology tests as you would like forever. So if you're looking to test your medical terminology, head over there to Certified Spanish, and we'd love to help you get a sense for where you're at with your terminología médica. All right, nos vemos la próxima semana. Chao, amigos.